Okay, let's dive deep into something specific today. We're looking at a condition that, well, it sounds alarming, and it certainly is for the young dogs it affects, puppy strangles.
Right. Known more formally in veterinary circles as juvenile cellulitis. It's one of those conditions that thankfully isn't super common, but when you do see it, recognizing it quickly is absolutely vital.
Exactly. We've looked closely at some detailed material on diagnosis and treatment, and our goal today is really to unpack it for you. Pull out the critical stuff without getting lost in dense medical jargon.
Hmm.
Whether you have a puppy or know someone who does, or maybe you're just curious about animal health, this deep dive should give you a clear picture of puppy strangles.
And it's something that can develop with surprising speed, so
Yeah.
that early recognition piece is just incredibly important.
So let's start right there. The fundamental question, what exactly is puppy strangles?
Okay, so think of it as a very specific, um, pretty severe inflammatory disorder affecting a puppy's skin. The hallmark is the appearance of, well, granulomas and pustules.
Granulomas and pustules, so like angry lumps and bumps.
Basically, yes. Inflamed lumps and pus-filled bumps that form right there in the skin. It's quite distinct.
And the name puppy strangles suggests it's mostly puppies, or only puppies.
Primarily, yes. It's very, very rarely seen in adult dogs. It
Yeah.
really is a condition that predominantly affects young canines.
Got it. And where on the puppy does this tend to show up? Is it all over or more specific spots?
It's actually quite localized, which is one of the key features. The areas most affected are typically the face, think eyelids, lips, the muzzle area.
Okay, the face?
Yeah, and it also commonly involves the ear flaps, the pinnae, and almost always you see noticeable, sometimes really dramatic, swelling of the lymph nodes right under the jaw.
The submandibular lymph nodes.
That's them. Yeah, they consistently get quite large.
So face, ears, under the chin. That's a pretty concentrated area for such, well, intense inflammation. Do we know why this happens? What's the root cause?
Ah, this is where it gets a little mysterious. The precise reason, the exact immunopathogenesis, it isn't fully understood.
Uh,
But the current thinking points strongly towards an underlying immune system dysfunction. It's sort of like the puppy's own immune system goes haywire and launches this intense attack on its own tissues.
so the body is mistakenly attacking itself? Is that the idea?
That seems to be the core issue, yes.
Yeah.
And there's also a suspicion, based on how it sometimes appears in related dogs, of a potential heritable component.
Genetic, you mean?
Exactly, a genetic link, suggesting some puppies might just be born with a predisposition for their immune system to react this way.
Fascinating. Okay, an immune system glitch, possibly inherited. So who is most likely to get this? We know young dogs, but is there a specific age window or certain breeds maybe?
Yep, definitely just dogs. And the typical age range is quite narrow. Puppies between about 3 weeks and 4 months old. That seems to be the real vulnerability window.
Wow, 3 weeks to 4 months, that is really young.
It is very young.
And any particular breeds that seem to pop up more often in the data?
Well, any puppy in that age range could potentially get it, but certain breeds do seem to show up more frequently. The information we looked at specifically mentioned golden retrievers, dachshunds, and Gordon setters.
Goldens, Dachshunds, Gordon Setters, quite a mix there.
It is.
Okay, so we know the what and the who. What about the look? If someone's puppy, maybe one of those breeds, in that age range starts developing this, what are they actually going to see?
Right, and this is where the urgency really kicks in. The onset is acute, meaning sudden, and the progression is typically rapid. You can often see pretty dramatic changes within just 24 to 48 hours.
Wow, that fast. A day or two.
Yeah, it can be incredibly quick, and that sudden, often really dramatic facial swelling is a major hallmark sign, particularly around the eyelids, the lips, the muzzle. The puppy's face can look quite puffy, distorted even.
So a rapidly swelling face is a huge red flag then.
Absolutely. And like we said, coupled with that, the marked enlargement of those lymph nodes under the jaw is almost always there.
Okay, swelling, big lymph nodes. What else?
Beyond the swelling, you'll see prominent pustular and exudative dermatitis, which basically means the skin gets inflamed with those pus-filled bumps and it can become kind of weepy or crusty.
Oozing or crusty spots.
Yeah, sometimes even forming little draining channels, which vets call fistulous tracts.
Ugh. So angry-looking skin on the face, swelling, big lumps under the jaw. Is it just visual or is the puppy uncomfortable? Does it hurt?
Oh, it's definitely uncomfortable. The affected skin areas are typically painful if you touch them. You might also see pus-filled inflammation in the ear canal, purulent otitis externa, it's called.
Right, so painful skin, maybe gunky ears too. And does the puppy just have these local problems, or do they feel sick all over, like systemically?
That's a good question. Systemic signs effects on the whole body are actually pretty common. What the data shows is that at about half, maybe 50% of cases, show lethargy. They'll just be really tired, listless.
Half of them are tired.
And then roughly a quarter, about 25%, might show anorexia, they lose their appetite, and pyrexia, which is just a fever.
So a quarter have a fever and aren't eating. That's a significant impact beyond just the skin.
It is. And something else also seen in about 25% of cases is something called sterile suppurative arthritis.
Arthritis in the joints.
Yeah, inflammation in the joints. But importantly, it's sterile. That means there's no bacterial infection causing it, which, again, really reinforces the idea that this is the puppy's own immune system causing the problem, not some outside bug.
Joint inflammation without bacteria.
Yeah, that's another strong hint about the immune system being the driver, isn't it?
It really is.
Are there any other, really unusual ways this condition can show up?
Rarely, yes. Very occasionally, you might see something called sterile pyogranulomatous paniculitis. It's a mouthful, I know.
Okay. Paniculitis?
Yeah, it's inflammation of the fat layer just under the skin.
Okay.
Sometimes it looks like soft, sort of fluctuant nodules, maybe on the body, or sometimes specifically near the percutial or perianal areas.
And those can break open, too. They can. Sometimes they fistulate, meaning they drain.
Yeah.
Again, those are much less common presentations than the typical facial swelling and lesions.
Okay. So primarily face, ears, neck lymph nodes, often making the puppy feel pretty unwell and all developing super quickly. Given how dramatic it looks, and I guess the overlap with other potential issues, how do vets actually figure this out? How do they diagnose it and rule out other stuff?
Right. The diagnosis really relies on putting together those key clinical signs we talked about, but also carefully considering and ruling out conditions that can look similar, and then ideally getting characteristic findings from a skin biopsy.
So what are some of those look-alike conditions? What else could cause, say, a swollen face and pustules?
Well, there's a list of important differentials, things the vet needs to consider, like simple bacterial skin infections like folliculitis or furunculosis, or dermatocosis, that's mange mites. Could be a drug reaction, sometimes a deep fungal infection, maybe severe allergies, cutaneous hypersensitivity, even reactions to vaccines, or potentially insect stings, like from bees or wasps. Lots of things can cause swelling or skin lesions.
That's quite a list to work through. How do lab tests help narrow it down?
Cytology is often a really helpful first step. That's just looking at cells collected from the lesions, maybe from a needle aspirate or an impression smear under the microscope.
And what do they typically see?
Usually they find what's called pyogranulomatous inflammation, that mix of inflammatory cells, the big macrophages, and the neutrophils. But crucially, there are typically no microorganisms, no bacteria or fungi visible in those early samples.
Ah, so the inflammation is there, but no obvious bug causing it initially.
Exactly. And often the neutrophils, those first responder cells, look non-degenerate, which is a technical sign suggesting they haven't been directly fighting bacterial toxins. That sterile finding is a really important clue, pointing away from a primary infection and more towards this immune-driven thing.
Gotcha. What about cultures, like bacterial cultures?
Yeah, they're often done. And they're frequently sterile, meaning no bacterial growth early on, but they can become important later. If a secondary bacterial infection does set in on top of the damaged skin, the culture helps guide antibiotic choice.
Okay. And the most definitive test, the gold standard.
That would be the skin biopsy, taking a small piece of the affected skin for microscopic examination histopathology.
And what does that show?
It reveals those characteristic clusters of inflammatory cells, the granulomas and pyogranulomas. It often shows destruction of the little oil and sweat glands in the skin, the sebaceous and apocrine glands. And in later stages, you might see more widespread sort of pus-forming changes deeper in the dermis, and sometimes that paniculitis, the inflammation of the fat layer underneath.
Wow. It sounds like the inflammation is really doing some damage deep down, not just on the surface.
It absolutely is. It's quite destructive.
Okay, let's get to treatment then. Given how fast and aggressive this thing is, how is it managed? What's the approach?
Early and aggressive intervention is just critical. The source material really emphasizes this because getting control quickly is crucial to prevent severe, potentially disfiguring scarring, especially around the eyes, where scarring can cause both cosmetic issues and sometimes functional problems later on.
So speed matters immensely. Minimizing that long-term damage is a huge goal. What does aggressive treatment actually look like?
Well, topical treatments, creams or ointments applied to the skin, they can be soothing, maybe help a bit with secondary infection, but they're definitely not enough on their own. They're purely an adjunct, something used in addition to the main therapy.
Okay, so what is the main therapy?
The cornerstone medication, the primary treatment, is high doses of corticosteroids.
Steroids, like prednisone.
Exactly. Prednisone is commonly used. The specific dosage often recommended is pretty high. 2.2 milligrams per kilogram of the puppy's body weight, usually divided and given twice a day, every 12 hours.
Whoa, 2.2 kilograms twice a day. That is a substantial dose, especially for a puppy.
It is. It's an immunosuppressive dose. You're trying to really damp down that overactive immune response.
And how long does the puppy stay on that high dose?
The recommendation is generally to maintain that high-dose therapy for at least 2 weeks. Sometimes longer, depending on the response, but at least 2 weeks.
And after that initial high-dose period, you can't just stop, right?
No, absolutely not. It's crucial not to stop abruptly. The dosage has to be gradually decreased, tapered over a period of, say, 2 to 4 weeks after that initial phase.
Tapered slowly.
Very slowly and carefully. If you taper too quickly, there's a significant risk of the condition relapsing, flaring back up again.
Right. So high dose for a couple of weeks minimum, then a slow, careful reduction over maybe a month or so. What about antibiotics? You mentioned all the pus and inflammation. Seems like you'd need those.
That's a really common question. Antibiotics are generally only used if there's clear clinical or cytological evidence of a secondary bacterial infection.
Secondary meaning bacteria that jumped in after the initial inflammation started?
Precisely. So the antibiotics are considered an adjunct therapy in those cases. They're used alongside the high-dose corticosteroids. The steroids are tackling the underlying immune problem. The antibiotics are just there if bacteria have opportunistically invaded the already damaged skin. They aren't the primary treatment for the strangles itself.
That's a really important distinction. Treat the immune response first, add antibiotics only if needed for complications. What if it's a really, really tough case? Does anything else ever get used?
The material mentions that for very rare cases, ones that might be resistant to the standard corticosteroid therapy, certain chemotherapy agents might be considered, but honestly, that's quite uncommon. Usually the steroids work well if started early enough and dosed correctly.
Okay. So potent steroids are the main line of defense. What's the typical outcome then? If they get that treatment, what's the prognosis for these puppies?
Generally, the prognosis is actually quite good, provided the puppy receives appropriate and timely treatment. That early aggressive intervention really makes a huge difference in the outcome.
That's good to hear. And once it's treated successfully, does it tend to come back later in life?
Thankfully, no. Most cases do not recur after they've been successfully treated and the steroids properly tapered.
Excellent. That's really positive. But you mentioned scarring earlier, particularly around the eyes as a concern. Can that happen even if the treatment works and the condition goes away?
Unfortunately, yes. That's a key point. Despite aggressive and timely therapy, scarring can still be a significant lingering issue, especially in those delicate areas like the face and around the eyes.
So permanent tissue damage.
It can be, yes. It might lead to cosmetic changes, hair loss or altered skin texture, or sometimes even functional problems like affecting how the eyelids close or function if the scarring is severe there. It's definitely something owners need to be aware of as a potential long-term effect, even with successful treatment.
So even though the condition itself resolves, the sheer intensity of that initial inflammation can leave permanent marks behind.
Exactly. The body's own powerful inflammatory response, even when you get it under control, can sometimes cause irreversible damage to those delicate skin structures before it subsides.
Okay. Well, let's try to bring this all together then. What we've explored in this deep dive into puppy strangles or juvenile cellulitis, it's this uncommon but very serious inflammatory skin condition.
Right.
Hits puppies, typically super young, like 3 weeks to 4 months old. There might be a genetic link making some breeds more susceptible, like Goldens, Dachshunds, Gordon Setters maybe. It comes on incredibly fast, like 24, 48 hours fast, causing really dramatic swelling, nasty lesions, painful inflammation, especially on the face, ears, and those big lymph nodes under the jaw.
Yep, classic sign.
And often makes the puppy feel pretty sick overall, tired, maybe feverish, not eating.
Right, those systemic signs are common.
Diagnosing it involves recognizing these very distinct signs, ruling out a whole bunch of other look-alike conditions,
Crucial step.
and ideally confirming it with tests like cytology and biopsy that show that specific kind of inflammation with without finding bacteria as the primary cause.
That sterile pyogranulomatous inflammation is key.
And the treatment hinges on getting in there really quickly and aggressively with high-dose corticosteroids like prednisone to shut down that over-the-top immune reaction.
Absolutely critical.
Then tapering those steroids super slowly to prevent relapse, and only adding antibiotics if a secondary bacterial infection actually pops up.
Exactly. Steroids first, antibiotics only if needed as backup.
So I guess the big takeaways are that rapid onset and the critical need for prompt, decisive treatment with those immune-suppressing drugs, that seems vital for anyone encountering this.
It really is. Time is of the essence to get the best outcome and minimize that scarring potential.
And, understanding conditions like this, even the ones that aren't everyday occurrences, it really highlights how important it is to pay close attention to young puppies and to get veterinary help fast if something just looks dramatically wrong or changes suddenly. The difference a day or two makes seems huge here.
It absolutely can be.
Yeah.
And maybe stepping back for a final thought.
Yeah.
The fact that even with successful treatment, even when you stop the disease process and prevent recurrence, that permanent scarring can still be an issue.
Yeah.
What really underscores the sheer power of the body's inflammatory response, doesn't it? How it tries to heal or fight off what it perceives as a threat. But sometimes that very response can leave lasting damage in its wake.
Huh. That's a really interesting point, that complex balance. The fight itself can leave scars, even when you ultimately win the battle against the condition. Definitely something to think about, especially when we're talking about these fragile young animals.
Exactly. It speaks to both the resilience and the vulnerability we see.